So today we are going to discuss how to calculate infusion rate for norepinephrine, which is also known as noradrenaline. Now we know that this is the 1 ampule, and as per its level, 1 ampule contains 4 milligram of noradrenaline per 4 ml. Now, if you're going to calculate infusion rate, there will be a formula, and the formula is this one: the dose multiplied by weight of the patient multiplied by 60 divided by concentration. Now, let's say uh, start moving through this formula. Let's say we are calculating this infusion rate for a patient having a weight of 70 kg. So this is the weight. Now, for every medication, there is a standard dose which has been calculated through multiple experimentation, and which is the safe dose, and there's a safe window which we call it as therapeutic window. So the dose for norepinephrine is zero point 0.2 to 1 microgram per kg per minute. So this is what the standard dose of norepinephrine is. Now, moving forward, we need one thing which we will find depending upon how many pills we are mixing in normal saline or Pladix or whatever. So concentration we need in order to calculate depending upon how many pills we are diluting. So let's say the common practice in our med floors are 2 ampules 2 ampules, sorry, in 100 ml of normal saline. So 2 ampules of norepinephrine in 100 ml of normal saline. So we know that 1 ampule contains 4 milligram of norepinephrine. So 2 ampules will contain how many? It will be 2 multiplied by 4 norepinephrine milligram of norepinephrine in 100 ml of normal saline. Now it's 8 mg norepinephrine in 100 ml of normal saline. Now, moving forward, look at the concentration in the formula. The units are microgram and ml. So we have ml here, but we don't have microgram. We have milligram. So let's convert this 8 milligram into microgram. So it will become 8,000 microgram of norepinephrine in 100 ml of normal saline. Now, if 8,000 microgram are present in 100 ml, how many will be present in 1 ml? So divide both sides by 100. So when we divide it, so 1 ml of normal saline then will contain 80 microgram of norepinephrine in 1 ml of normal saline. We just divide it by 100. So now we have this concentration, we have the weight, and we also have the dose. So let's put in the formula. I will copy and I will paste it here for ease. Now the dose which will calculate initially is for zero point 0.2. So this is 0.2 to 1, so we will calculate for separately for each dose, but let's start from 0.2. Now the weight of the patient is 70 and the concentration which we have calculated is 80 microgram per ml. So put it 80. Now let's calculate it that it is 0.2 multiply by 70 multiply by 60 equal to 840, and we will divide it by 80. So what it turned out is 10.5 ml per hour if you are using a dose of 0.2. So it's important, if you are using dose of 0.2 microgram per kg per minute. Now, so this is when you have mixed 2 ampules in 100 ml of normal saline. You are using a dose of zero point 0.2, then it will be 10.5 ml per hour. So we know that the safe dose is 0.2 to 1 microgram. So we can go up to 1 microgram. So I have already calculated it, and let's see, for a patient of 70 kg, if you're using zero point 0.2 microgram per kg per minute, then it will be 10 ml per hour, approximately 10.5. So is the exact value. So now when you increase it to zero point 0.4, so it will be 20 ml per hour, zero point 0.6, so 30 ml per hour, zero point 0.8, so 40 ml per hour, and 1, which is the last dose and the highest dose, is 50 ml per hour. So if when you have mixed 2 ampoules of norepinephrine in 100 ml of saline, you can increase the rate of that solution to 50 ml per that infusion to 50 ml per hour. That's the maximum, and you can start from 10 ml per hour. So depending upon the uh, BP, blood pressure, and other factors of that patient, you can increase it up to 50 ml per hour when you have mixed 2 ampoules of norepinephrine in 100 ml of normal saline. So that's all from my side. That's the we will also try now to calculate uh, infusion rate for dopamine as well as for other vasoactive medication. Uh, that's it all from my side.